Welcome to Safest Talks, a space where experts share evidence, clinical experience, and practical insights to advance safer, high-quality patient care. In today's episode, we explore how environmental sustainability can become an integral part of safe, high-quality perioperative care. This episode is based on the safest environmental health standards, which encourage healthcare organizations to reduce their environmental impact through the responsible use of resources, sustainable clinical practices, and environmentally conscious decision-making. From reducing waste, energy consumption, and water use to promoting greener buildings, sustainable procurement, and environmentally responsible anesthetic practices, these standards aim to protect both patient health and the environment while building more resilient and sustainable healthcare systems. Today's guest is Dr. Oliver Gröne, Adjunct Professor at Witten, Herdecke University, Chief Scientific Officer at OptiMedis AG, and an internationally recognized expert in healthcare quality improvement and sustainable health systems.
Hello, my name is Oliver Gröne. I'm the Chief Scientific Officer at OptiMedis and Professor of Health Systems and Health Policy at the University of Witten Herdecke in Germany.
Why is environmental sustainability becoming an essential component of patient safety and quality of care in healthcare organizations, particularly in the perioperative setting?
For a long time, we've treated the subjects of quality and patient safety on the one hand and climate impact on the other hand as distinct subjects, but we know now they are much more related than we previously thought. And we can see that now in Europe with the heat waves taking its toll and thousands of people died. So hospitals really have to face the new realities and prepare for that. But there's a much more direct link of relevance to the Safest project. Healthcare systems contribute a large proportion of CO2 emissions in any given countries. Studies suggest that about 5% of all carbon emissions in a given country are related to the healthcare system, so that it's more than shipping and aviation combined in any given country. So that's really a significant amount. And in the Safest projects, we can address that and really have an impact on reducing the CO2 emissions in healthcare, particularly in the context of surgery.
From your experience, what are the most effective strategies healthcare organizations can implement to reduce their environmental footprint while maintaining safe, high-quality patient care?
The good news is that we know what we can do to reduce the climate impact of healthcare. The evidence has really emerged in the last 5 to 10 years, and a lot of evidence-based strategies are now available to reduce the climate impact in healthcare. Let me just mention 3 which I find most relevant in the context of the Safest project. The first type of interventions is really avoiding unnecessary services, interventions, or tests. There is a long history of investigating that, particularly you might have heard about the Choosing Wisely international campaign that looks at interventions for which the evidence suggests they don't add to patient value, they add a lot to healthcare systems cost, but they also add to emissions. Any CT scan avoided reduces significantly the CO2 impact of the healthcare system. So that is really the first start, unnecessary tests and investigations. Secondly, there are some what we call hotspots in the healthcare systems, and the surgical theater is one of the key hotspots, particularly through the use of anesthetic gases. The main culprit that has been identified in the past couple of years is the anesthetic gas desflurane. 1 hour of even flow desflurane in an operation equates to about 6,000 to 7,000 kilometers driving a petrol car. So it's really significant. And talking to anesthesiologists, I've learned that often it's easy to substitute desflurane for other agents or intravenous anesthesia. So I leave that for the clinical community to solve, but the evidence suggests it's possible. Some countries have phased out desflurane altogether. Scotland, I think, was the first, and new EU regulation also addresses desflurane as a main anesthetic agent that contributes to climate change. But then the third subject is probably the topics we have been dealing with in hospitals for many years, particularly around waste disposal, use of recycling, better use of recycling, better use of electricity in areas that are not used permanently. So there are a lot of activities altogether that can be implemented in a hospital setting, for which the evidence suggests it's possible, for which case studies suggest whole countries have phased it out. So the message is really, it's possible, we just need to get started.
Many hospitals are committed to becoming more environmentally sustainable. What are the main challenges they face when implementing these practices? And how can multidisciplinary teams help overcome them?
The biggest challenge, I believe, in implementing climate-friendly policies is related to the perceived effect on quality and patient safety. And I emphasize perceived because the evidence suggests that in high-income countries there's really not a trade-off between improving quality and patient safety on the one hand or reducing the climate impact on the other. There are probably settings or countries where hygiene is at a different level, where single-use products have their place, but for most of Europe, for high-income countries, that is really not the issue, and evidence suggests there is not a trade-off between improving safety and reducing the climate impact. The other challenge is probably related to the fact that no one really owns this process in the hospital. There might be a designated officer or designated person in charge of climate impact, but the truth is it really requires working together in multidisciplinary teams, bridging surgery, nursing, hospital hygiene, administrators, procurement, bringing all these people together to understand how each of the professions, each of the different departments contribute to the climate impact, and how together the hospital can change. And procurement has a very important role here as well. And that's in a sense also what we've seen in the Safest project. Patient safety requires working together across disciplinary boundaries, and I think we can expand this learning to improving the climate impact or reducing the climate impact, and using the same multidisciplinary approach to make hospitals a safer but also less impactful place for the environment.
Anesthetic practices have been identified as an important contributor to the environmental footprint of healthcare. What opportunities do you see to make perioperative care more sustainable without compromising patient safety?
Anesthesia is one of those hotspots where hospitals can really make a difference in reducing the climate impact. And I've already alluded to desflurane earlier. Desflurane is a real killer. It can be phased out safely. It can be substituted safely with other gases or with IV anesthesia. And many countries have suggested this is actually not so difficult to do. There just needs to be a will to do it and move ahead. Culture change is always at the core of this, and the clinicians, particularly the anesthesiologists, need to be fully supportive of this process. The other area, of course, is nitrous oxide, and that's another area of climate impact in healthcare that really doesn't contribute a lot to patient health gain, because of a lot of the nitrous oxide is actually lost in the hospital through defect pipes and tubing. So that needs to be addressed as well. It's very important to emphasize that, particularly in anesthesia, and particularly with the change in anesthetic agents, this is never about withholding any treatment or withholding a better alternative to the patients. Safe alternatives exist, they can be easily implemented, and it adds to value to the patient, it adds value to the health system, it is cheaper, and it also makes hospitals a better place for the planet.
If you could recommend one action that healthcare organizations could implement tomorrow to make perioperative care more environmentally sustainable, what would it be and why?
Well, I don't want to mislead you. Reducing the climate impact of a hospitals is not a simple undertaking. It's possible. Case studies suggest it, evidence suggests it, countries suggest it, but it's a lot of work. And the question is, how do we prioritize our work in order to address this very important topic? It is critical and we have to do it. And sometimes it just requires a champion, one person, to take up this subject and get started. And the single most important point, which I've mentioned various times, is death for rain. Look at the operating theater, look at the anesthetic gases. That's a very, very easy start with very quick wins. I'd also encourage you to Google first carbon neutral surgery. That's a case study of colleagues in Birmingham. They've conducted a carbon neutral surgery looking at all the steps, including death for rain, but also transport, electricity, waste segregation, planting trees in the backyard of the hospital to provide shade in the summer. So again, nothing of that is rocket science. It's all rather feasible, but again, it requires action. And someone has to take action for that. Once that person or a group has been assembled, I'd really encourage you to look at different standards that exist. We have incorporated in Safest a set of standards that were developed in collaboration with Healthcare Without Harm, a global leader in this field, and the International Health Promoting Hospitals and Health Services Network. These are 8 standards that look at the key hotspots in healthcare and offer some opportunities to get started. So if I could just end on one message, is really, if there's no one in the hospital yet addressing this subject, just take this plot, just work on it, just become the champion. And I'm sure you will assemble a large group of followers behind you and can really lead change in your healthcare system wherever you are.
Safest is a Horizon Europe-funded initiative dedicated to advancing safer perioperative care through collaboration, innovation, and shared learning.